I'm Dr. Nicholas Jones, Nipandtuckplasticsurgery. The question of today is, what is a BBL? BBL, what is a BBL? Well, a BBL is a Brazilian butt lift. And the term Brazilian, yes, that is where the surgery was invented. And so basically what it is a liposuction. And typically the liposuction is performed on the trunk, and it usually includes the abdomen, the flanks, the lower back, the mid back, and some include the upper back.
We're done with the lipo. She has a pretty long torso, but we gave her a little bit of definition right here, if you can see that right there. And now we're just gonna get ready to flip her. We're gonna put some fat in her hips. This little area that we marked here is the area we want to concentrate on, get more of this when we flip her over, especially right here, and we'll be able to take her waist.
And instead of discarding the fat is transferred to the buttocks and the hips.
So this side is done. You can see we got some volume here on this hip. Let's look at this hip. You can see the difference.
And that is a Brazilian butt lift. Now the fat can be taken from any part of the body. What makes it a Brazilian butt lift is the actual fat transfer. This surgery's been around for some time now, and as you may or may not know, it gets a bad name. And the reason being is there has been a very high mortality associated with the procedure. However, the association with the high mortality is due to several things. One, you have non-plastic surgeons or unqualified individuals or healthcare providers performing this procedure. Number two is when that happens is the fat is supposed to be transferred to the subcutaneous space. If the fat is transferred beneath the muscle, the gluteus maximus, or your buttocks muscles, where all the blood vessels get lacerated or injured, and it creates an opportunity for fat to go into the blood vessels, into systemic, and it can go into your lungs and cause fat embolism, which can be fatal. The standard of care is to transfer the fat only into the subcutaneous space. Now that does have some disadvantages, the major one being when you put the fat into the subcutaneous space, you don't have as much control over the shape, as opposed to when you put the fat submuscular, you get much more projection. So here in Nipandtuckplasticsurgery, we follow the guidelines recommended to us, and I personally do not inject fat submuscularly.